As a finance professional in a disrupted business landscape, what does it take to be in demand? What does it take to attract great paying international roles? If you're an ICAN member, it'll just take one exam. That's all it takes to complete the globally recognized CIMA professional qualification and the internationally respected CGMA designation. As a CIMA member and a CGMA designation holder, employers will look at you as a finance professional, constantly acquiring new skills to add value to the business. That's why they'll be willing to pay premium to hire and retain you. If you have 5 years of relevant experience and are an ICAN member, you can directly sit for the final exam of the CIMA Professional Qualification, the Strategic Case Study Exam. Start studying the CIMA Professional Qualification. Prepare to make an impact.
Good evening, professional colleagues. Good evening, friend of the Institute of Chartered Accountants of Nigeria. And it is my great pleasure to welcome you to another episode of ICAN on Air. This day, Tuesday, 4th day of the month of October in the year 2022. And it is with great pleasure I have my co-anchor, Olamide Balogun, joining me. Olamide, good evening.
Good evening, Chasson. Glad to be here again, and I'm glad to co-pilot this wonderful edition with you. Indeed, it's the last quarter of the year, and we are racing and happy to be around and to ensure that we wrap up the year on a high. Good evening, everyone.
Beautiful, beautiful. And to all our listeners, let me start by apologizing to us today that ordinarily we are supposed to have the second segment of Will and Codicil. But because of issues beyond our control, our guest is unavoidably absent at the show today. But we did a poll opinion of what it should be, and we have been told to come on that topic that is very key and germane to us on mental health. That was delivered by Mr. Adegboyega Ogunwale, and that is what we will be sharing with members today, considering the fact the importance of mental health, how germane that topic was on that particular day. And I want to believe that we will definitely benefit from this. Olamide, I'm sure we are ready to listen to our doctor delivering for us today.
Absolutely. And once again, we can't help but welcome our members in the diaspora, because we know we are actually international and global. So we say welcome to all our members in the diaspora for also making out the time to connect with us. As we take care of our body, we should also take care of our mental health. Hence, the importance of this very particular topic we're about to dive into. Thank you.
Thank you very much, Olamide. On that note, I'll be leaving you in the hands of our technical team as we have a repeat broadcast of mental health tips by Mr. Adegboyega Ogunwale, who will be doing justice today. Stay tuned and get connected. Let me quickly go on a very short break, knowing fully well that
all that matters is only to chase money, to separate money from health. So while money is not health, a key component of health will be what money can do. Now, in the Yoruba tradition, it is frequently said that if you are alive, that is when you can say you are wealthy. And that's what they say in Yoruba. They will say, Aiku Baale Oro. That if you imagine that there is a town called Oro, that is wealth, then the head of that town is to be in health. To that extent, health has been defined by the World Health Organization as a complete state of physical, social, and mental well-being, and not merely the absence of disease or infirmity. So that is a complete state of physical, social, and mental well-being. and not merely the absence of disease or infirmity. So you will find that money feeds into your physical health, feeds into your social health, feeds into your mental health, such that there is no well-being when those things that money can do are missing. But you will see that I emphasize what money can do rather than money itself. Because what money can do is regarded as structural determinants of health. So those things in society and our daily lives that help us to stay well, certainly money will play a part. But if someone were to imagine that all that matters is only to chase money and find it in liquid terms, that person will be quick to realize that money in its liquid form, in its soluble state, does not guarantee health, happiness, or well-being. It is only when it's able to do those things that structurally contribute to health, education, poverty reduction, social interaction, facilitating access to good health care. All of those things are the ones that money can really substantiate or give expression to. But money on its own, I'm afraid, does not really mean much.
That's a very wonderful way to start, giving us an in-depth of what health is all about, and talking health and money, a deep understanding that they are really inseparable, but at the same time, we must look at what money can do, not money in its very liquid form. That's very, very deep. During general health discussions and seminar, symposium, mental health is usually mentioned countless times. Doctors, well, let me just ask you this. What is mental health itself, and why must we take it serious?
Thank you very much for highlighting the fact that we talk about mental health very frequently, but sometimes we are not very certain or clear about what it means. As I had said about the definition of health itself, mental health is an integral part of health. And we have a slogan, we've had it for several years now, as a means of highlighting to governments, to policymakers, to the citizenry, the importance of mental health. And the slogan is this: there is no health without mental health. And why is that so? The World Health Organization has defined mental health as a state of well-being in which an individual can achieve 4 critical things. Number 1, can achieve his potentials. Number 2, can cope with the normal stresses of life. Number 3, can contribute to his community. Number 4, can work fruitfully and productively. I'll take those 4 again. Number 1, mental health is a state of well-being in which an individual can achieve his potential. Number 2, can cope with the normal stresses of life. Number 3, can work fruitfully and productively. Number 4, can contribute to his community. If you find anyone lacking in any of these 4 dimensions or facets, that person, until otherwise proven, must have a challenge with his or her mental health.
That's a very wonderful submission on the area we call mental health. There is no health without mental health.
Without mental health.
And you're able to break it down into 4 by saying one who is mentally, alert must be able to achieve his or her potential, should be able to cope under stress, contribute his quota, and work fruitfully and productively. That's a very deep one, and I want to see that our people are actually picking up on this. This is my next question, Doctor. My look a bit laughable. or elementary. I'm sure you know I'm an accountant. That's why I have an expert like you to come.
Yeah, accountants seem to know everything.
Well, not as much as the medical line, because that's yeah. Let me just ask: are there different types of mental health? If yes, can you just give us an insight into the different types of mental health?
Okay, so I think the way to look at it is there is only one mental health, but certainly there can be different types of mental disorders or mental health problems. So I would say that there are mental health problems that have to do with the way you think. They affect your thinking. There are those that affect the way you perceive. You know, you may be hearing things that other people cannot hear, that are not there, seeing things that other people cannot see. That's one we call psychosis. And then there are those that affect the mood. Your mood is your sustained feeling tone, the way you have been feeling in your spirits in the last, say, 2 weeks. Have you been feeling down or feeling quite up, or more than up? You are quite elated for no reason. That could be a form of mental disorder as well. There are mental disorders that have got to do with memory. So people who normally can recognize you and remember your name, maybe with age, they're unable to even recognize themselves, not to talk of other people. That's what we call dementia. There are mental disorders that arise from underlying physical conditions. It could arise because you're reacting to a medication. The person might have a brain tumor, might have a brain infection, might have trauma to the brain, which we call a concussion or a contusion. All of those things can lead to different forms of mental disorder.
Oh, that's a wonderful submission. So we have one mental health, but there can be disorder. Talking about the cycle, the mood, the memory, you know, name it. And that's a very wonderful way. Let me just state that viewers who are connected globally, you're free to bring in your question. And I can tell you that Doctor is set to do justice to some of the things. I can see a question from Paul before I proceed, because it has to be interactive. I can see you're smiling. What effect the recommended eyeglasses have on mental health? And how often is it advisable to change eyeglasses, or does the lens expire?
Well, I will be frank with you. That's a very deep question, because this gentleman is asking about the interaction between sight and mental health. And we haven't got all the time to look at the different dimensions to it, but let me stick to the direct question he has raised. Now, if someone has got problems with his eyesight, that problem might have to do with maybe an infection in the eyes, or maybe a refractive error. A refractive error is when we say you are short-sighted or long-sighted. Maybe you need to use the glasses to be able to see distant objects or close objects, or to read. Now, when you have that sort of condition, you go to the ophthalmologist. That is the medical doctor that is trained to diagnose eye conditions. Very many people go to those who will just do an eye test for them and then give them glasses. Now, that is not the best approach, because you are jumping the gun. The first thing is for you to have the diagnosis. The reason is there are those who have glaucoma, and the glaucoma is a disorder of sight, which will not be corrected by just wearing glasses. It has to be treated with certain medication or even surgery. But once you go and collect a pair of glasses, you may feel that your sight is better, but alas, your sight is actually getting worse. So the point I'm making is, make sure that you consult an ophthalmologist who is a doctor that is trained to diagnose eye conditions. And let's assume you have a refractive error. If you are given a pair of lenses, then you are likely to use those lenses for about 2 years. So the recommendation, if I recall correctly, is for you to go back for your review so that the lenses are revised every 2 years. Of course, before the lenses are changed, you will have another evaluation of your eyesight, not just your visual acuity. They can look at your visual fields as well as the pressure in your eyes. Now, these are things you will not get by the roadside. And these are the things that will really help you. Now, how does that dovetail into mental health? If you do not have your eyesight corrected on time, the eyes will be under a lot of strain and they will go into a zone of stress. Now, the stress of your eyes are enough to make you have a sort of psychological tension, which is now generalized stress, which can affect your mental health. So that is the link. It's not as if there is a direct link. Of course, there are times that people have tumors in their eyes, but they do not know. And the tumors may already be impinging on the brain. And that will also lead to a mental health problem. So I think the question here is, do not trivialize any health concern. Ensure that you have proper diagnosis, you have proper treatment, and you comply adequately with the recommendations of your doctor.
Very wonderful submission. Do not patronize the roadside, the quack. Make sure you get the right diagnosis, treat it properly, and adhere to the professional advice, as we'll do on our part to make sure that when we advise as professional accountant, we want professional like you to adhere to us and say you are reverting to us that we should adhere, diagnose it, take the normal treatment, and make sure that you comply. I'm coming to you, Olushola, to treat your question. But let me quickly pick this up with my doctor. Doctor, is stress related to mental health? If so, what role does this stress play in mental health challenges?
All right. Thank you, Mr. Moderator. You will recollect that when I defined mental health according to the WHO definition, the second domain or facet is that of being able to cope with the normal stresses of life. So stress is an integral component of our mental health. And let me quickly add that stress is a normal part of human life. As a matter of fact, without stress, performance will be impeded, will be impaired, will be inhibited. So to a level, stress is a tonic. But when it exceeds that level, it becomes a toxin. It becomes toxic to your system. Let me give you a typical naturalistic scenario. When a baby is born, you find out that everybody is waiting for that baby to cry out. And everybody rejoices because the newborn baby is crying. That is paradoxical. You're wondering, why are we laughing when the baby is crying? But alas, that baby's first cry is the baby's first breath. Until that time, that baby was like an aquatic organism swimming in the fluid in the mother's womb. But upon delivery, that baby's umbilical cord, the one that is attached to the body at the navel, that connects the mother and the baby, through which the baby was getting the nutrients and oxygen. That cord is clamped and it is cut to separate the baby from the mother. In doing so, pressure goes from that blood vessel into the lungs so that the lungs can begin to function. Now, without the cry of the baby, there is no oxygen entering into that lung or into those lungs. Consequently, we see that even from birth, stress is an integral part of human life. So the question will then be, what amount of stress is good enough? And what amount of stress is toxic? So, and I think we could go into that conversation as well. As
we proceed. That's a very wonderful way. So when we are faced with stress, from what you said, is a normal part of human endeavor, part of our life. That you said something, I was laughing within myself. You said it's tonic, and we know when you take tonic, it's to energize.
Yes, blood tonic. I mean, as a matter of fact, some people have done a study. We call it the Yerkes-Dodson curve, that has plotted your performance against your stress level. And it is practically like an inverted U curve. So when the stress level is going up, your performance will be going up until that performance level gets to a plateau. So if you increase the stress, instead of you performing better, you will now begin to have diminishing returns setting in. So I think what is critical is for us to be able to identify what level of stress becomes toxic to our systems. So that is why we don't talk about stress avoidance. We talk about stress management. It will never go away. You and I are here on air tonight or in the studio because we want to educate our world. We want to participate in enlightening our peers. But to do so, we are both under some level of stress to be able to carry out this program effectively. But without that level of stress, I will be talking slowly. I will not be making my points clearly. You would perhaps be distracted because your attention level will be impaired. But stress is pushing you to perform excellently, pushing me to perform optimally. Were I to drive myself more than is necessary, then I will begin to underperform. So on one hand, it is a tonic. Beyond the level, it becomes a toxin.
It is a tonic. Beyond the level, it becomes toxic. That's the takeaway. So when I go through stress, is to know the level at which I must be to be at my optimum level.
Absolutely.
Otherwise, it becomes toxic to me. Very wonderful submission. And let me state here that I have been guesting Miss Dr. Adegboyega Ogunwale, a chief consultant psychiatrist from a neuropsychiatric hospital in Abeokuta. A wonderful session. In fact, you are giving it to me the way I want it. Doctor, I want to ask, considering the drastic rise in suicide cases, you know, across the world, even locally, can you between mental health, depression, and suicide?
All right, so let's look at it this way.
Doctor, are you there?
Yes, I'm there. Can you hear me? You are frozen a bit. Can you hear me? Hello, can you hear
Doctor,
me?
are you there?
Yes, I am.
Okay.
I can hear. Yes, I can hear you.
Okay, you can hear me. I'm just trying to ask that, can you give me the relationship between the mental health, depression, and suicide, considering the high drastic rise in suicide cases these days?
All right, so depression is a form of mental disorder. As I told you, there are different types of mental disorders. Depression is a severe mood disorder. So you'll be feeling low, lacking energy, unable to eat very well, unable to enjoy things that you would normally enjoy. You might lack interest in things. And those would have been going on for about 2 weeks. So we say that that person is depressed. It can be mild, moderate, or severe. Now, when depression is severe, it comes with what we call cognitive distortions that can make a person feel like committing suicide. So what are those distortions? The person has a negative view of himself, what we call the idea of worthlessness. The person has a negative view of the world around him, that they are not able to help him at all, what we call the idea of helplessness. And then the person has a negative view of the future, what we call the idea of hopelessness. When these cognitions come into the picture, these distortions in your thinking come into the picture, the person can begin to think there is no need to live, and the person may then attempt suicide. Usually, there are risk signs that one might see. So the person might talk about it. People feel that when people talk about suicide, it means they don't want to commit it. No, it's not true. When people talk about it, they may actually be contemplating about it. The person may talk about it frequently or very scarcely. The person might post it in a social media platform or something of that nature. The person may begin to give away things or sort of donate some of his property to people the person may begin to change in his appearance, either underdressing or overdressing, either overreacting or underreacting. And usually when these things happen in somebody who has been recently bereaved or recently lost a job or had a business failure, you must put all of that together and say, are we sure these are not risk signs for suicide? For some, they will engage in risky behaviors. Some of these risky behaviors will look like drinking alcohol excessively, using terrible drugs so that can knock them off. Some of them can go into overdose. Some of them can actually engage in risky sexual behavior. So you would think, oh, he's just running around town. What's wrong with it? Sometimes it is a manifestation of suicidal intent. So these are all the things that one might see. And when we see these things, should we be quiet and say, let everybody mind his business, stay on your lane, I stay on my lane? No. We should approach such people. We should converse with them about their problems. We should help them to seek support. We should follow them up. So it's not just one day of talk. Follow the person up. So you left somebody in the night. In the morning, be the first to call. Otherwise, they could have committed suicide overnight. So it's not just making the approach, but following up. And where you can see that they are so depressed that you cannot dissuade them from such a suicidal plan or intent, then you must reach out to emergency helplines or to professionals who will be able to take it up from there. Because the intervention is multi-level. There is the biological, there is the psychological, and there is the social intervention to help the depression to lift so that the person will no longer feel suicidal. As a matter of fact, if you're able to treat the depression, it is very likely that the suicidal feelings will go away. Research has shown that at least 90% of those who attempt suicide have one mental disorder or the other. And close to 40% of those actually suffer from depression. As a matter of fact, about 10% of those who have a form of severe psychosis like schizophrenia will attempt suicide, about 10 to 40%. And about 10% of them will eventually commit it. And about 15% of those who have depression and have not received treatment are likely to commit suicide. So you see, 15 out of 100 is a whole lot. And we need to be sure that we are able to recognize those early signs, intervene in our own little way. And where we can no longer intervene, connect them with the required support and help. And that will be very helpful.
Thank you very much, Dr. Ogunwale. And to our viewers, I'm noting your question and I'll bring them up at a time. But let me just take this because I want to start from the general view and then dovetail to the specific. Sir, you are in this country, Nigeria, and we understand what is happening globally. If we look at the challenges confronting Nigeria, Nigeria, and Nigerians that are actually, living
within it. Yes.
Such as insecurity, joblessness, high cost
yes,
of living,
unemployment,
inflation,
high cost of living, yeah.
Everything. It speaks to me that many Nigerians has mental issues. Correct me. What's your take on this, sir?
Well, I will not be quick to say that they already have mental health problems. What I will be quick to say is that all the risk factors for developing mental health problems are there. They're abundant. Okay? They're abundant because these are the structural determinants of health that we don't have. So your child of 8 cannot go to school because you are unemployed. You cannot pay the school fees. So the child is under stress. You, the father, you're under stress because when you wake up in the morning and you see your child at home, you break down in tears. The child sees you in tears. The child is crying as well. And the child's future is already being mortgaged at that rate. Imagine what it would mean if education were free, truly free. That stress goes away from the parent immediately. These are the structural determinants of health. Now, in this country, as we speak, 70% of healthcare payments for healthcare, they are out of pocket. Out of pocket. And you have people in this country that are about 66% living below poverty line. And I am modest. It's more than that. Very frequently you hear Nigeria is becoming maybe one of the poverty capitals of the world and all of that. The truth of the matter is that where there is poverty and deprivation, you have set up a state for mental illness. Because one of the ways mental illness results is what we call the stress diathesis model. That is, people already have their own weaknesses psychologically. When stress now appears on the scene, it will break them down, and then it will suffer what you would call a mental health problem. So insecurity can give people anxiety. And from just mild anxiety, they can progress to what we call moderate anxiety or severe anxiety. Now, if they get into anxiety disorders, then they will need treatment for that. And where did it come from? From insecurity. And I'm not talking of insecurity of kidnapping or even banditry. I'm just talking about insecurity of armed robbery, one chance, armed boys entering your house and stealing your things. Even if you were not there, you feel so insecure that anxiety begins. And you know, the Yoruba people have a beautiful saying about when you don't have money. They say, I know Baba Jaya. The meaning of that is when you have no money, anxiety is provoked in you, even without you wondering why. I mean, this is a cultural perspective to it. And once you don't have money, you just become anxious. I mean, I think I have a different perspective to how you can deal with that. And that is by looking at life beyond having money or being liquid, looking at life in other ways. That's where people cope. And when we talk about stress management, maybe we can be able, we can talk about that. But let me round up my answer this way, that there are many risk factors. Look at those who have been kidnapped before. Some of them for the next 4 years will be unable to sleep well. So from that kidnapping, they're going to have sleep disorders, post-traumatic stress disorders, acute stress reactions. I mean, you name it. Even psychotic breakdown can result from that. What about the uncertainties in the business environment? A business climate is very hostile. Foreign direct investment is going down. Inflation as of today is over 20%. So with inflationary pressures, even if you have savings, the money in your bank is going down day by day without you spending it. Purchasing power parity to the dollar, you can't even think about it. So it's almost unbelievable what the Nigerian citizen is having to live through. But God is faithful and a merciful creator. He has always helped us as a nation. I'm a man of faith. I'm not just a scientist. And at this point, we can only turn to God to touch our leaders to see that they've got responsibilities to redesign their approach to governance and politics, to ensure that the dividends of democracy are not just slogans, but they speak to the structural determinants of health, which will promote mental health.
That's deep. And you have used one stone to kill about several birds, talking to us individually, collectively, and to our government to have a way of giving back, not just talking about poverty alleviation by mouth, but having
sloganeering.
It's not about that. It's implementing that so that an average citizen can participate on this. Sincerely speaking, Dr. Ogunye, you are taking us to class. I said the other time that I want to come from the perspective of general to specific. And now I'm taking it to the professionals now. You know, when you talk of professionals like doctors like you, accountants, engineers, teachers, lawyers, name them, core professional. You and I understand that, like you say here, it's about mental, calculation rather than the physical that we have.
Absolutely. Yeah.
Don't you think that we are vulnerable to mental health challenges?
Well, I will agree with you entirely, without a doubt. Those who are in high pressure professions, like accountants, lawyers, doctors, engineers, even teachers, whether at the level of the universities, colleges of education, secondary schools, they go through a lot of cognitive stress, a lot of emotional stress, a lot of put it together, psychosocial stress. So let me take the scenario of the accountant. So the accountant who is working with an employer who is not self-employed has a mandate of preparing the accounts for his firm or his company. Now, it may look like a simple task, but because there is responsibility of integrity, transparency, of honesty, all these ethical obligations, they put extra pressure on him. So when he's looking for 10 kobo, the doctor wonders why that should be a problem. But no, the accountant cannot sleep because of 10 kobo. He can't. He has to start all over again.
Accuracy is the watchword, sir.
That's the point. So accuracy puts an extra pressure on him. So you might think, oh, after all, he's just working for 8 hours. He works for 8 hours, but is unable to sleep all through the night because he's reliving his calculations, looking for the 10 kobo. So it's a high pressure environment. Now imagine an accountant who runs his own firm. Oh, please. Maybe he works only when he's got PHCN. If he doesn't work only when he has PHCN, he will be driven crazy by the price of diesel. Because to run a business and to be a professional accountant will now be the two problems that he is going to deal with. He's a business owner as well as a professional accountant. I'm sorry if I'm sounding too passionate. I feel helpless sometimes when I see a society setting people up for emotional breakdown and we can't see it. Because he's not going to survive. He will age very quickly and he will wonder why. But imagine if he's got power supply, he doesn't have to think of diesel or the price of diesel. Imagine if he doesn't have a job for the next 6 months. There are safety nets within the country to help him to survive. Imagine if he has access to loans that are at very affordable rates to be able to keep afloat. He will be happy to run a business. So these are the issues. I mean, look at doctors, for example. There have been times in this country when doctors were on strike for 3 whole months. And the National Health Act 2014 stipulates that the Minister for Health will do everything in his power to resolve industrial actions within the health sector within 2 weeks. It's a statutory obligation. Do people follow it? You know, so during those times, those who are mentally ill have no access to their treatments. If they do, it's suboptimal. I mean, when the people who are even well developed early signs of mental illness, the hospitals are closed down. We can go on and on when we look at high pressure environments and mental health problems. Look at the lawyer who has got to read maybe 10 judgments before the next court sitting because maybe the opposing side gave them the documents only at the last hearing. And it was a short adjournment. I hold a background in medical law and ethics. So I have an idea of how long the judgment is. And you've got to read it, distill it, and see how it supports your case or how it is useful for you as an argument. That takes you a lot of work. And the pressure is so much that some of these lawyers, in order to cope, we start using substances. They say, if I drink 2 bottles of Star, I'm able to cope better. Before long, they become dependent on alcohol. And it started from the high pressure work environment.
Sincerely speaking, Dr. Ogunye, just like my chairman is saying, I think we'll look out for time once every quarter to come. One of our members just mentioned it, that the way you are analyzing this mental health issue is something we need to take with all seriousness. And sincerely speaking, the only way I can ease the tension or the stress of anchoring this program is by laughing. Because
which is humor. Which is humor. It's a form of dealing with stress.
And
it's a defense mechanism.
If you take me to this question, I don't want to be seen as not patronizing the pharmacist or the pharmaceutical company. But I just want to ask, because I believe it's a personal assumption that I'll take these drugs a lot. I just want to ask, how or what are the possible ways that professionals can handle this issue of mental health without taking medication?
Well, I think the first thing is we tend to take these over-the-counter medications to cope with stress, to deal with stress, largely because we do not recognize when our stress levels are being exceeded, our normal stress levels. So I think the first thing we need to understand is, how do you recognize when stress is getting toxic, when it is no longer a tonic? So you find out that you might just notice some unexplainable mood changes. You may feel unduly sad. For no reason, you'll be feeling guilty and not up to your work normally. You may feel that you are no longer as competent as you used to be, and there's no basis for it. You may have a feeling of terror, as if something is about to happen to you that is very negative. And then you might have difficulty controlling your emotions. And this is when you go home with work and you shout on your wife, or you go to work from home and you shout on your subordinates. You get away from this place. Can't you just behave yourself? Not because of anything, but because you are getting stressed from home. And sometimes somebody annoyed you at work, the stress was too much for you to bear, you will take it home. And then when your wife just says, honey, I was work today, you say, what do you mean? Well, I can't see the anchor anymore. I hope
we are not together. We are together.
Right. Okay, so you get on to a point where you are telling your wife, what do you mean by that? Did I complain to you? Why are you asking me what work is? That's what everybody is saying. You are trying to tell me I'm not working enough. It's a question of stress that is making you aggressive, and you are displacing the aggression. Of course, you can have vague physical complaints. I usually crack this joke each time I'm talking about that. You know, when you ask someone, he comes to your hospital the first day, he says, doctor, I've got typhoid. That's what I have. I've got typhoid. Says, no, you don't have typhoid. I think it's malaria. Then you give him anti-malaria. It goes 2 weeks later. He says, doctor, I felt better for a few days, but now I think it is typhoid. Can you treat me? Then you look at his blood film. You say, okay, maybe there could be something. You give him antibiotics. It goes home and then returns. He says, doctor, I don't have malaria now and I don't have typhoid, but I have a very strange kind of condition. It starts in front of my head. It will make a sound like zzz. Then when it comes to the middle, it does a sound like yes, it just sounds bah. No, there is no condition like that, really. So when you ask him, all right, so sir, how are you doing at home? How is work? Then he says, home cannot be better. I'm doing very well. My wife is fine. My children are doing fine. Actually, my firstborn is in Covenant University studying accounting. My second child is in Babcock studying medicine. My last child is in Bowen studying medicine. You know where the headache is coming from. You know where the sensation in his scalp is coming from. It's coming from the stress of having to source all these school fees. Okay, so from that, you will see that the stress did not show as maybe the man talking irrationally. It showed by vague physical complaints. Some people, it will be poor sleep or sleeping excessively. Some people, they have reduction in their productivity and what you call absenteeism or presenteeism. So they're absent from work or they are there, but not there. So these are the things you might see, indicating that the stress level has been exceeded.
Very wonderful submission. And Sulaiman Ismaila is asking this question, that how often within a year should a professional like accountant have medical evaluation?
Okay, that's an interesting question. So as a matter of fact, we don't recommend that people should have routine mental health evaluation. Because as a matter of fact, many people live in this world for 80, 90 years and they never have a serious emotional breakdown. What by far we recommend is mental health promotion. What are those structural determinants of mental health in your life? Your education, poverty reduction, access to health care, employment, good social interactions. These are the things you should work on. You may never need to have a mental health evaluation. However, what are the indices that will tell you that you should seek a mental health evaluation? Those 4 things that I told you about. If you find that you are no longer achieving your potential, you should seek that. If you find that you are finding it extremely difficult to cope with the normal stresses of your life, if you find that you are working but it is no longer fruitful or productive, or if you find that you are no longer contributing meaningfully to your community, by the time you look at these 4 different facets, you will know whether you need to have a mental health evaluation. And when you do, typically, if there are no problems, we would see patients that have no serious incidents, maybe once or twice a year. That's the way I would like to look at it. Yeah.
Very wonderful submission. So I can say the bedrock for every professional listening this day is the 4 cardinal points that you've given. Check yourself. Are you achieving your potential? Check yourself. Are you coping with the normal stress, knowing fully well that stress is a tonic in a normal human life? Look at your contribution. Are you contributing meaningfully to your immediate environment? And look at your work life. Are you working fruitfully and productively? And if there is any missing link, seek professional advice so that it will not go far. Dr. Ogunwale, you've been doing justice. And I can tell you, this will try to have every quarterly. You mentioned something which I have picked, and I will talk to the producer. Stress management. I think it's very fundamental. And in no distance time, we'll be looking at how we can look at that, because looking at the totality of our discussion today, stress, you said we cannot avoid it, but we must manage it. So we must manage it. About stress management. Let me go ahead with this, Dr. Ogunwale, by asking Nigeria and Nigerians, do you think the Nigerian professional bodies generally are doing enough in terms of collaboration, sensitization, advocacy to help members from being victims of this mental health casualty?
Well, to be honest, I've not done any systematic study of professional bodies. So I'm afraid I will not be able to comment authoritatively. But speaking as a psychiatrist who has had the privilege of working intersectorally, giving lectures and talks in different sectors of the economy, from banking to other aspects of the financial sector, to health, to, educational settings, I have found that organizations are trying to become more aware, but certainly the awareness on mental health issues is not yet enough. As a matter of fact, it's not just restricted to Nigeria alone. All over the world, it's a global conversation that is being had around mental health in the workplace. The role of organizations in ensuring that those who are under their auspices have all the support they need for mental health promotion, preventive paradigms, and early treatment and rehabilitation. So I would say that it's not just typical of Nigerian organizations. I think in other parts of the world, things are being done, but a lot can still be done. So what must we bear in mind? First and foremost, there is a need for awareness. So that's the first thing. And that is what ICAN is doing here. And I'm so grateful to ICAN for the privilege. Now, I consider it a great privilege because ICAN on Air is a platform on which we can reach a global audience. And among the people in the audience are actually business owners themselves, professional accountants who run finance organizations or audit practices. And if they are able to implement awareness, healthy workplace systems, good communication, flexible work schedules within their settings, they would have contributed largely to improving mental health in the workplace. Because the World Health Organization has made clear what we need to do: implementation and enforcement of health and safety policies, including getting your employees to know what support is available, providing them links to mental health interventions, and ensuring that your health package for your staff is integrative, not just physical health, but mental health as well. So if somebody were to tell you at employment that he's got a mental health problem, your capacity to make what we call reasonable adjustments in the workplace for such a person, because the mere fact that he's had a mental health problem before does not mean he cannot cope with your work. But it means that if you stress him too much, he may decompensate. So your argument will be, oh, in that case, let me not hire him. But that will be against the UN Convention for the rights of people with disability, because that would be discrimination. Until you met him and he confessed to you that he had a mental health problem, you thought his CV was fantastic. You thought he had a PhD at Oxford, and you can involve him as a consultant. But when he declared his mental health status, you now say, no, let's look for a way to edge him out. That would be unfair. Because even those of us that are mentally well, what is the guarantee, the assurance that tomorrow we may not decompensate ourselves? So that's the way to look at all these things from an organizational perspective. There is a need to involve employees in decision making so that they have a sense of control over their professional and employment destiny. They need to have career development opportunities. These are all the things that business owners, organizations must be aware of as being integral to maintaining adequate mental health.
Very wonderful submission. But one thing I'm saying is that time is not always our friend. Time is another stress factor. Anytime I'm on the show,
I agree.
because it will allow my audience that are globally connected to have a feel of my guest all the time. Sincerely speaking, you've done justice today. But in closing, Doctor, I just want to ask, you're very close to us as a professional. I know Madame is one of us. Is there a way that the accounting profession can collaborate with the medical association, the dental council, or possibly to develop syllabus that will come regularly as seminars or symposium on health, accounting, and accountability? I want justice to that in 2 minutes.
You know, there was one study that I was part of, and we found in that study that for you to see that accountants are prepared for globalization of accounting practice, internationalization of accounting practice. And we operationalized accounting practice as things like thin capitalization, cloud computing, IPSAS and IFRS, all of that. One thing that was critical was your mandatory continuing professional development. It was critical to preparing accountants for internationalization. I was just analyzing the data basically as a statistics person. And it was quite interesting that is the mandatory professional development course that powerful? It is a very veritable platform that you can host a mental health awareness talk or curriculum on. And you can do that quarterly, you can do that twice a year. I'm sure the Association of Psychiatrists in Nigeria, if you sign a memorandum of understanding with us, that would be a done deal. I believe so, because we are always looking for platforms upon which we will be able to educate the general public, professionals who are lay in the mental health sense, so that they are able to see what needs to be done to safeguard mental health, because it is better to prevent than to aim at kill.
That is a very wonderful way to bring our discussion to a close today, Dr. Adegboyega Ogunwale. Sincerely speaking, I have to say this, that time is putting me under stress because I want to enjoy you the more. But like we've said, this is a session that we will
So how are you going to manage it?
The way I'm managing it is to bring the humor into it and laugh as we are laughing, so that it will not be, I'm taking it as tonic, so that it will not be converted into toxic. That will not be.
Oh my. Excellent.
That's
excellent.
A very wonderful submission, and I must appreciate you, Dr. Boyega Ogunwale, for making our time to educate our members, giving us some mental health tips as professionals, an area to guide against them. We've said this, we'll always look out for, maybe as part of the collaboration between yourself and our institute, bring you up to talk about this issue of mental health, stress management, so that our members can have the foreknowledge. We want to live long. We want to enjoy some of the things we have labored for. I want to say thank you on behalf of the Governing Council of our great institute. And I know anytime we call upon you, you are always there, because if you refuse to come, I only tell Madam to do justice as a professional colleague in handling your case.
Well, that means...
Wow, that was indeed a powerful session. A big thank you again to Dr. Boyega Ogunwale for enlightening us about why we need to pay serious and close attention to our mental health. Once again, dear professional colleagues, I would like to say a big thank you for tuning in to this wonderful Tuesday edition of ICAN on Air. And I'm looking forward to meeting you again, same time, 6 p.m. on Thursday, the 6th of October, 2022. Where we'll be discussing another wonderful topic with a live guest in our studios. On behalf of myself, Olamide Balogun, and my colleague, Olusegun Kwade, will say thank you, keep learning, keep growing, and stay healthy. Bye for now.